It is my privilege now. If we can start off with a small applause to the first session that is gone. A little bit of applause. I think we need a little bit of energy also in the room when we start our academic session. So, if we can start off with the first academic session. If I can welcome Mr. R.K. Sundar, General Manager Imaging, Clinical Partners, GE Healthcare South Asia, for the first session. He is an alumnus of Trivandrum Medical College, where he completed his diploma in radiology technology and did his post-graduation in imaging sciences from the renowned Sri Chitra Tribunal Institute of Medical Science and Technology. He has been working with GE Healthcare for the past 2 decades and been a key contributor in developing new CT scanners and algorithm in reconstruction and post-processing. His interest includes development of visualization tools and using AI in CT reconstruction. Today he will brief us on the usage of spectral imaging using dual energy in various clinical applications in head-to-toe routine imaging in CT scan. This is the unique facility that we have in SMS that he'll be sharing. And over to Mr. Sundar sir for the next session.
Thank you, sir, for the warm welcome. And once again, a very warm welcome to all the dignitaries here, all the clinicians here. Great story about the strong machine, maybe the world's fastest CT scanner being installed in SMS Jaipur, and the team enabled this fabulous achievement to serve the needy at a very low cost, as well as one thing Shravan was telling, the reach which we are able to make with this system and the clinical abilities. It's my job to take you through what is called spectral imaging in a nutshell, and in various clinical scenarios, how this can be a differentiator in bringing out the clinical outcome in a most useful way with high degree of specificity. So that's why I put the slide, the starting slide itself as revolutionizing CT. And of course, if you read bottom, I put one more line there, see the unseen. So we'll be taking some comparison where spectral CT was able to see something which a normal CT was not able to see. So with that, I start the presentation. Few things which had been always there in mind when you are doing CT scan: how fast it can scan, how much is the detector coverage, whether it can do cardiac very well with something called temporal resolution. Revolution CT, what is installed here, maybe India's second system to install to be here, and first system in a government institution is here in SMS Jaipur, that is the Revolution CT. Really, as the name implicates, it's a revolution in CT imaging. There are so many things that are there inside. I'm not taking you through this technological thing, but one thing which I want to tell is the fastest scanner, a 512 slice CT scanner with dual energy spectral capability, which has very powerful tube data transfer system, and more interestingly, this contain real gemstone as the detector material. That makes the CT completely different. It is gemstone inside. So we call this as gemstone CT as well. So those who have not seen the CT at the installed place, this is how the CT is, and this rotates at a speed of 0.28 seconds. So almost like more than 5 times in a second. That's the speed at which the gantry rotates. The force of that is above the speed of a rocket which escapes to the space. So this is the speed at which we are slicing the whole body, and that enables us various clinical application. One of the most important clinical application is in cardiac imaging using gemstone CT. In cardiac imaging, what you need is high resolution, very high resolution, so that you can see small lesions in coronary vessels, which are typically 2 to 3 millimeter, and the lesions are much smaller. So what you need is a very high resolution, and gemstone CT, unlike the other normal CTs, which are also there called 256 or 512, gemstone CT gives you 230 microns or 0.23 millimeter of spatial resolution. That means you can see structures as small as 0.23 millimeter. We achieve it by this revolutionizing technology of gemstone detector and the clarity imaging chain. Getting into cardiac imaging, irrespective of the heart rate, whether it's a low heart rate, high heart rate, variable heart rate, or if there is an arrhythmia, the system can do the whole heart in 1 or maybe in 2 beats. 2 beats, that's all the time required. And also, completely the procedure is non-invasive, and the beneficiaries are those patients who all are at high risk in developing a cardiac disease, or anyone typically above the age of 45, what we call as high risk category. So hypolipidemia, diabetes, family history, these are all the indications of having a cardiac CT done. It is a simple screening procedure. Of course, it involves use of contrast media, but at very low radiation doses, equal to that of almost like I can say almost 1/6 the dose of normal coronary angiogram in cath lab. So it is a great tool to look at the heart. And many of the dignitaries have been beneficiaries of this technology being used so that they can detect early cardiac disease and go for an appropriate treatment. As a case which is in front of you is a patient with a mixed plaque. You can very well see a small calcified plaque there, and the depth or the detail in which you can see all the coronary vessels to the distal branches. That's what I called it as 230 microns or HD resolution. You can not only stop this scanning with the heart, you can also extend that to look at the carotids and look at the intracranial vessels also, because cardiovascular disease are always classified as a disease which involves the 2 critical organs, the heart and the brain. So you can, with the same injection of contrast media, you can look at both coronaries and you can look at the brain as well in a single setting, and completely non-invasive, a coffee time or a tea time procedure. That's all it is. Maybe some patients who is having symptomatic and who is there on the disease, but we want to assess whether a stent need to be put, whether the plaque is vulnerable plaque, whether it is calcified plaque. Here is a case where you see HD high definition imaging is used to look at the plaque here in the right coronary vessel. You can beautifully see the black colored soft plaque as well as the calcified plaque around. And this specific view is very specific to G, is called IVUS view, virtual IVUS view. You can see the lumen and you can see the plaque very well. Many times, when you look at the heart coronaries, we want to look at what is the status of myocardium. That makes more important decision in terms of treating the patient. Here we have facility to do myocardial perfusion and look at the viability of the myocardial or remaining myocardium, whether this need a treatment or some kind of a conservative management. As I said earlier, heart rate doesn't make any issue for us. It's a walk-in. Here you see an example of patient who is having heart rate almost like 56 to 109 BPM, and look at the image quality what the system has produced. This is why when I started, it's a very fast rotating scanner that makes this essential requirement fulfilled even for such challenging patients. When we have spoken about using CT scan, there had been always a question what you will do for the pediatric patient. A system which is faster need to be kind to the pediatric patient. That's what we have realized with Revolution CT. Usage of low kV, low energy, will enable very low radiation dose to the pediatric patient. That's one of the highlights of the scanner. So we have seen high definition imaging all across different part of the body. Now we'll see some example in neuro. There is a right MCA occlusion. You can see the red arrow there, and the reason being the right carotid. You can see at the bulb level, there is a mixed plaque formation that probably has moved up and created this. Sometimes you get CT scan for patients who are having metallic implants, and it's very difficult to see the structures below this or in its vicinity or in adnexa with the metal implant. They create a lot of artifacts in CT. We have a great solution called Smart MAR with Spectral, will enable you to see the structures. You can see 2 pictures here. One is without metal artifact reduction and the other one is with metal artifact reduction. So it clearly removes the metallic artifacts from the implants. Now we'll get into Spectral CT. Spectral CT, how this is being heard is a CT which will make you to see the unseen. I put two images in front of you. This is done on a normal CT, a renal cyst. Renal cyst, as you know, is water. Cyst is nothing but water component, which has a Hounsfield unit or CT number of 0. But the moment you are given contrast, cyst should not enhance, right? But on a normal CT, you have seen the cyst is increasing its Hounsfield unit. That means, is it a tumor or a cyst? This is what today's problem with the current routine CTs, whereas spectral CT can now clearly say which material it is, whether it is tumor or whether it is cyst, very clearly. That's why we say this is CT, spectral CT is more sensitive and it's more specific in identifying non-conspicuous small lesions. There are multiple technologies are there in dual energy imaging, and spectral CT ranks the highest in it, and this is also called fast KV gemstone spectral imaging. How this is done? You have an X-ray tube and the detector there. The detector, as I told earlier, is gemstone detector, and the X-ray tube fires the X-ray very fast at 2 energies, 80 and 140 kVs. And with that, once you are done your scan, you get the result. And very interestingly, when you're doing a spectral imaging, many times you need not have to, you need not have to do the plain scan. You can directly get patient scan with contrast and get plain scan out of this. That makes the radiation dose almost goes by half compared to a normal CT. So many advantages are there. It's one of the advantage. We will see some of them now. Across the body, head to toe, there are so many applications are there. These are the global publications from 2010 to 2017. You can see major applications comes in cardiology, oncology, and in vascular, as well as in orthopedics. Of course, there's a infographics very clearly says which all are the key areas where we'll be focusing across the body. We'll see some of the examples. Let's start with neuro. This patient had undergone an intervention for thrombolysis. When we injected contrast, what has happened? Contrast would have leaked into the interstitium because of the excess volume there, and immediate CT on the cath lab showed a bleed kind of thing. So they were suspecting a bleed. Whether it is contrast or bleed, no one knows. Normal CT cannot differentiate this. We have done a spectral CT and suppressed the iodine, suppressed the contrast. You can see on this image, there is no iodine there, right? That means it is not bleed, it is the leak of contrast which was present as hypodensity in a normal CT image. Now you see the difference between a normal CT to a spectral CT, how it do value addition in definitive diagnosis. A patient who was done with shunt, there was some injury happened. Now we want to see whether contrast is there or how much is the portion of bleed. So you can see the upper image and the lower image. What you see down is blood and iodine suppressed. You can see the volume of blood leaked, and the up image, top image shows both blood and the contrast together. So you are able to differentiate different material even though they appear as white in a normal CT. So that's why we call spectral CT is material specific. Here is a case where you have basilar top aneurysm being coiled, and what the neurosurgeon wants to see is whether there is remaining aneurysm or not. In normal CT, it's very difficult to see. You are seeing little bit artifact there and you are not able to make out any aneurysm. But the moment you are gone for spectral CT, you are able to clearly see the coil and the amount of aneurysm there, the remaining aneurysm. This is one of the good application which I have seen. Do a single scan with contrast and you get the plain scan out of this with accurate Hounsfield unit measurement. And this is called virtual non-contrast imaging. The advantage is that you do the scan with half the dose and half the time. So patient benefit in terms of both renal, those patients who are having renal compromise, you can reduce the contrast volume. Second, you can get the plain scan from that, so the radiation dose is also reduced, and overall time is reduced for the patient on the CT bed. So you see on the top is the normal contrast image. What you see here is a virtual non-contrast image created from the images in the top row. A carotid plaque. Now we want to see how much is the remaining lumen here, and there is a method to suppress the calcium and show the lumen alone. Now it's very clear for us, with the calcium and the lumen together, you will not be able to make out how much is the remaining lumen, but with the material suppressed calcium, we are able to see the lumen versus the remaining the suppressed calcium. A patient with acute chest pain, nothing was suspected, nothing was actually much visible on a routine CT, and what we were able to see is intramural thrombus, which you can see with the arrowhead. So here we have done blood imaging, iodine suppressed. Pulmonary thrombus imaging. In any normal CT, you will be able to easily make out pulmonary thrombus. It's easily visible. What spectral CT can give beyond it is it can give you iodine perfusion of the lung. That shows the functional lung volume clearly. What will be the patient prognosis? Or during the therapy itself, you can have a follow-up and say how much the patient has progressed visually, not only seeing the thrombus, but also visualizing the amount of lung return to the normal perfusion. He is the patient who had 7 days of treatment and a follow-up scan, and we were able to pick up those areas where there is no perfusion. You can see them as black areas, and the normal perfused areas are in blue. That's because of the fibrosed lung, which is not responding. Right? So whether to continue the treatment or you can happily discharge the patient if the patient is functionally doing well. So this decision can be made out from spectral imaging. A female patient who came with abdominal pain, and she had breast lump being detected clinically. We have done a spectral imaging. Of course, breast imaging is not yet established as a strong modality with CT, but we have done a breast scanning along with the abdomen. So we are able to see a breast lump there, and the periphery of the lump is having high iodine, and the center is necrotic. So we want to see whether it is what necrosis it is. This clearly says a negative curve on the spectral analysis, which says that it is fatty necrosis. Whereas on a normal CT, it will be very difficult to say whether it is fat or whether it is because of water exudate. The same patient, we have done small lesion detection using a very specific AI-based software, and this is called lung Vicar. This will help you to highlight the lung nodules very easily. And in the same patient, you can see a small liver lesion with again a central hypodensity, and the central hypodensity is fat necrosed, periphery is enhancing. So breast metastasis to the liver. This one is a contrast image on a normal CT, 120 kVp image, and no lesion was detected in this cirrhotic patient. The moment you have turned on the spectral mode, we are able to see enhancing rim there, and on iodine map, you are able to clearly see the small lesion there. So otherwise, you would have happily missed it on a normal CT. Young patient, 34-year-old, with elevated enzyme level. Normal CT was showing something doubtful, maybe a vascular shadow we thought, but the moment we did gone for the spectral analysis, we were able to pick up multiple small dots there, which are all enhancing, multinodular HCC, and the vascular image showed corkscrew vessels, which is a clear indicator of what we are encountering with. When you have patients who have undergone, say, RF ablation, we want to see how much is the progress of the patient over a period of time. Here, this is the initial scan, and you can see in the iodine map well-seen lesion, and these are the follow-up scan on spectral CT, which says no iodine or minimal iodine enhancement. So that means the patient is well responding to your RF ablation, which is normally not visualized on a routine CT. This is another case where they have done TACE, not RF ablation, TACE. So you see on a normal CT image, you are not able to pick up any lesion, but when you have gone for a monochromatic spectral imaging, we were able to clearly pick up the small enhancing nodular lesion there. So the entire diagnosis changes, and the treatment pathway for the patient changes. A patient with gallbladder perfusion, you can now see the clearly opened gallbladder and the gap there with a spectral image. And the same patient had hypoperfusion of sigmoid loop. So usually these areas are unseen on a normal CT because enhancement changes are not easily appreciable on bowel on a normal CT, whereas spectral CT with iodine imaging will help you. We'll see some inflammatory bowel disease. This patient had some bowel problems, so we have done a CT. So you can clearly see the enhanced portion of the cecum there with bright enhancement at monochromatic images, whereas a normal image will be looked like this. So you can see how spectral imaging makes the difference in efficient diagnosis. This patient, an old age person who came with ischemic colitis, diagnosed elsewhere, then we did a CT angio which shows the IMA thrombus, and then we have gone for bowel imaging with spectral, and you can see no enhancement of large portion of the colonic wall. When we did a follow-up after 5 days to do, because she developed a left leg pain, and we were able to, right leg pain, and we were able to see a thrombus inside aorta, and that was dislodged to the lower extremity. So the patient had a thrombus in aorta which got dislodged. So we have done multiple diagnoses using spectral imaging there. Another case of ischemic colitis, normal image looks very difficult to interpret. The moment you have gone for spectral image, you can see no bowel, large volume of the bowel is unenhanced. So that is the power of spectral imaging. Another area where spectral imaging makes a difference is in GI bleeds. Very difficult to identify small bleeds, but the moment you go for something called iodine image, you can see pooling of contrast in the bowel. And of course, here you are able to track the vessel also, and whatever marked in red color is the bleed. And in the spectral image, you can see it's well highlighted. So you know the site of bleed, you know which vessel is causing the leak. A patient with multiple things inside, gallbladder shows something like a stone. So we created a fat image. It shows negative curve, confirming that it's a fatty calculus in the gallbladder. The same patient had intensely enhancing GIST, showing high degree of contrast enhancement. And of course, she had something more here in the left kidney. We didn't know really what is this. The moment you put an ROI, it showed a fatty curve. So that is nothing but angiomyolipoma. So how specific spectral CT can be. In your routine case, when you're reading the image, you can make the difference of what this is. Rather than simply telling it's a cyst, you can now confidently say it is an angiomyolipoma. This case was more challenging. Suspected enhancement. Really, if you look at this image, you are not able to see any enhancement here. Rather, it's looked like almost like a cystic thing with a pseudo enhancement. The moment you put a spectral curve ROI, you show the positive curve, upward curve, which says that that's an enhancing lesion. So the entire diagnosis changed from hyperdense non or benign liver lesion, renal lesion to a renal mass. So that's a specificity of spectral imaging. There's a case where follow-up scan on prostate, you can see the central enhancing zone of the lesion, which is usually not seen on routine images, whereas spectral CT was able to pick it up well. A patient who presented with suspected renal mass, when we did multi-phase spectral images, we were able to pick up areas of low perfusion. They are not brightly perfusing. What you see in yellow color is normal kidney, whereas what you see in the blue color is the non-perfusing area of the kidney, which clearly says that this what you are encountering is not a renal mass, rather it is renal abscess. So what happens when you have renal mass? Renal mass will look something like this. This patient has a renal mass. You see bright contrast enhancement in the iodine map, and you see the vascularity there, the blood vessel descending into that. So this is what the spectral CT will give very specific on the cases. Of course, as you know, stone imaging, renal stone imaging is very common with spectral CT, where you can differentiate different type of stone, whether it is bruchite, whether it is calcium oxalate, monohydrate, dihydrate, or struvite, with specific atomic numbers. There are multiple cases are there. Here you have a case where this one is uric acid, calcium oxalate suppressed, whereas calcium oxalate, uric acid suppressed image, you can see it's bright, which clearly says that this stone is calcium oxalate stone. On a normal CT, it looks bright, but it's very difficult to say whether it is calcium oxalate or uric acid. Of course, the treatment differs for different type of stone. So we can be very specific in renal stones as well. In orthopedics, multiple application, one of them is to identify the edema on CT. MR is very sensitive for edema, but in trauma it's difficult to do MR for a long, because it takes a longer time compared to CT, you can easily identify the edematous place in a CT. You can see the edematous area versus the normal bony area. Same thing in wrist also. I'll show quickly an example. You can see now the edematous area in the wrist very well, which are seen in white color, which is not seen usually on any normal CT. And of course, when you have spoken about the contrast dose, we have seen the radiation dose is less, it's half. We can do very low contrast volume CT also for those patients who are renal compromised. For example, this iotogram was done at 20 ml of contrast with low injection rate, but we have used gemstone spectral imaging and low KEV monochromatic images to create this image. In a normal CT, your image would have been something like this, which is of no use. So spectral imaging also help you to reduce the contrast volume. In peripheral angios, it helps you to see the smaller digital vessels much better using iodine images. So you are able to see most of the vessels very well. When you have heavy calcium, it is very difficult to see the lumen. You can put on spectral imaging there and look at the lumen without the calcium. So that helps you to efficiently look at the volume or the area or the diameter of stenosis at the affected area. Just to summarize, quantitative CT imaging with spectral CT is the great innovation today, which is very specific in terms of identifying, characterizing the lesions with high degree of quantitative specificity and help you to arrive at definitive clinical diagnosis. Once again, thanks to the Sony team as well as the SMS team for giving us this great opportunity to just showcase the technology in front of you. I know that it was very quick. We were able to showcase some cases. Definitely we can have a discussion during the dinner time. Just inviting sir to come and announce for the next session. Thank you so much.